Welcome to UT Medical Center, ranked one of the nation's top hospitals by U.S. News and World Report.
Hi, I'm Dr. Nikki Zeit, and this is the University of Tennessee Graduate School of Medicine OBGYN Clinic. On Friday mornings from 8 to 12, this is the Family Planning Institute, where we see a variety of patients for their contraceptive needs. In this video, we'll touch on all 6 of the ACGME core competencies, as well as address many of the APCO-CREOG learning objectives related to contraception and office patient care. Prior to inserting an IUD on an actual patient, our residents practice with the pelvic models. We're going to demonstrate how an interaction between myself and one of our residents prior to insertion would go. So, Dr. Compton, you've already counseled this patient and she has elected to have an IUD inserted. Please tell me what you're going to do when you walk into the room.
So the first thing you want to do is a bimanual exam to assess the tilt and size of the uterus.
Great.
And then you'll insert the speculum, grasp the anterior lip with a single tooth tenaculum, and sound the uterus.
We've already sounded this uterus to 7 centimeters. Do you want to go ahead and show me how you do your insertion?
Okay. So holding gentle traction on the single tooth tenaculum, insert all the way to the fundus, then pull back 1 centimeter.
Slide her back to the white line. Count to 10 as those arms open up.
Then all the way up,
Okay.
and pull the rest of the way down.
Perfect. While holding traction on the tenaculum, you insert the device all the way up to the fundus, bring the entire device back 1 centimeter, use your thumb to draw the slider back to the white line, count to 10, move the entire device back up to the phalange at the cervix, and then use your thumb to slide the slider down all the way, and then remove your inserter. These are very different than the hormonal IUD in that the arms are actually put in down. And for placement, we're going to use sterile gloves in the room, obviously. There are ways to do this with the plastic on the packaging so that you don't touch the arms. I find it very challenging, okay? And then you are going to measure your phalange just like you do sounding with the other device and set your phalange at the level of the uterus. You put your stabilizer into the inserter. And then you hold everything steady until you get into the uterus. Okay. And you go in your uterus, again holding the tenaculum like you mentioned last time, up to your phalange. Okay. Now with this device, you need to pull your inserter back to allow the arms to open up while you hold your stabilizing rod. And then you push back up just to make sure you're still at the fundus. And then you bring your stabilizing rod out and your inserter out. And now you're just placed. With this device, you again hold traction on the cervix with your tenaculum. Go into the fundus. Draw back your sheath while holding your stabilizing rod in place, allowing the arms to open. Push your sheath back up to make sure you're at the fundus, and then withdraw your stabilizing rod and your sheath.
One of the ways we get the residents and students to visualize the insertion technique is to actually be the IUD. So here we have some volunteers who are going to be the IUD. We're going to start with the copper device. And you guys saw, so the copper device is the insertion, like Dr. Brown is showing us. Your arms are down, okay? And then the sheath is removed. What happens to the arms? They pop out. You confirm that you're at the fundus. And then we pull the inserter out. Excellent. For the hormonal IUD, how are your arms in the inserter? Excellent. So when you go in all the way up to the fundus, you have to come down a little to allow the arms to open. And then you go back up to the fundus, and you remove the inserter.
The residents, as they're working up to their skill level, really have to prove to me they know the tilt and size of a uterus. Dr. O, what do you think?
I would say she's anteverted, probably about 7 centimeters or so.
All right, well, let's get the speculum in and the sound, and let's see if she's right. One of the techniques techniques to increase comfort with IUD insertion, both for the inserter and for the instructor, is to use ultrasound guidance during the placement. It gives a little bit of certainty because obviously IUD's placements are blind. So the instructor can watch the placement on the ultrasound as can the inserter. So we're going to try to demonstrate ultrasound guidance of an IUD placement at this time. Oh, pretty view of the uterus, and look at that sound going up to the fundus. Use your tenaculum to pull your uterus a little bit straighter and make it even easier for you. Okay? Alright, we're going to get the IUD to do the right size for you, and then we'll get it placed. Okay. Alright, so once again, we're going to watch the uterus get a little bit straighter as we pull on the tenaculum. Good. And now we're going to, with direct visualization, see the IUD go up to the fundus. See, there we go. Then move the IUD back a little bit. See? Excellent. Now, go ahead and pull down to the white line. Open up your arms. Count up to 10. Move back up to the fundus. And put the IUD in. Sometimes due to the patient's body habitus or the shape of the uterus or tilt of the uterus, the picture isn't as perfect as that. And so doing a transvaginal ultrasound after can also reassure you that you have the IUD in the right place. This is our intrauterine system, which does not have any metal on it, so you really see it mostly by the shadowing on ultrasound. We hope you enjoyed our short video on teaching IUD insertions. We really wanted to focus on our contraceptive clinic and how, although contraceptive care is only a small aspect of OBGYN care as a whole, it does encompass all of the ACGME core competencies and several of the APCO-CREOG learning objectives. Thank you.